Like nature has made it, we are human beings, and whether we like it or not, we'll become ill at some point in our lives. It could be a physical illness like hypertension or diabetes, or a mental illness like depression or anxiety. And at that point in our lives, we need all the love and support that we can get from our friends, our families, and society. But can we boldly say that people with mental illnesses get this love and support when they need it? If not, why is this so? We are going to find out today. Ladies and gentlemen, you are welcome to the Mental Health Affairs Show. I am Iya the Medic, and I'm your host. With me today are two amazing guests, and I believe that our interaction today is going to be very interesting and very educative. So my first guest is an amazing young woman, very beautiful. She is very smart. She's a medical student in 5th year or her 2nd clinical year. She is a debater as well as a diplomat. Alberta, you're welcome. My second guest is also a diplomat and a public speaker. He completed Kwame Nkrumah University of Science and Technology, where he studied construction, technology, and management. With me in the studio today is Mr. Gideon Agyapong. Gideon, you're welcome.
Thank you.
Okay. So I think we can delve right into our discussion. So when we hear about mental health, people have a lot of funny ideas about what mental health is actually about. Okay, so when we say mental health, what is mental health? I'll start with you, Gideon, because you are not in the health field, and so I want to have an idea about what somebody who is not in the health field thinks mental health is about.
Well, personally, my understanding is based on a little bit of theory. So in my field of study, paramount to our operation is the well-being of our workers, our operators. So mental health is simply your state of mind. How well is your state of mind? For a lay person, our understanding of mental health has been sort of narrated in a way that it's about how people are perceived to have mental problems. So you realize that when you raise a topic about mental health, people are expecting the next thing to be about madness or people on the street or people reacting differently to normal situations in life. So basically, my understanding of mental health is a compass of the two. The state of well-being from theory and the layman's understanding of madness, absurdity.
Okay, Alberta, so what's your take on this?
So mental health is a state of well-being where an individual is able to realize his or her own potential, and that person can cope with the normal stresses of life and can also work productively and fruitfully, and most importantly is able to add a valuable substance to their society. So that's WHO's definition of mental health.
Okay, so like both of them have rightly said, mental health is a state of well-being. And then, like he said, when we hear mental health, all we think about is that mad person on the street. But we all have to understand that each and every one of us has mental health. We need good mental health to function every day. So mental health is about all of us and not just somebody on the street with their clothes off and looking very dirty. Now, moving on, we realize that research has shown us that more than 10% of the world's population are currently suffering from mental illness, right? So we have over 700 million people who are suffering from mental illnesses. But we realize that we ignore the topic so much. We don't like talking about mental health. When you mention mental health, people think that it's something they can just, brush off. So what do we think is the problem? Why are people not paying so much attention to mental health? I'll start with you, Alberta.
So when you look at the statistics, it's like 1 in 4 people have a mental illness according to WHO. So if we were 4 people here, meaning that one of us would really have a mental health issue. Yes. But the fact that we don't even know about it means that 3 things can be true. It's either we are failing to see that it's there because we just don't know about it, or we are not acknowledging it because there's some sort of stigma associated with it, or we are just failing to see that it's even there. So those things are things that make us not want to acknowledge mental illness like it's with us.
Yeah, that's true.
Well, my understanding is many people are ignorant of mental health illness or mental health well-being. Most of the times, the only time we realize mental health is when the person shows signs of aggression, abnormal reaction, or start taking off their clothes. But there are very simple, common signs that could lead us to come to the conclusion that someone's having mental health concerns that we should take into concern. So, for instance, I understand simple stress is a sign or a signal that someone is beginning to pick up a mental health disorder. Simple taking away themselves from people is part of the reason. So ignorance predominantly is one of the reasons why we don't even talk about the problem, because in Africa, what we don't know, what our parents don't know, they don't tell us about, and what we don't know, we don't go around talking about. So I think ignorance is the bedrock of it for me.
Yeah, that's true. So like you rightly said, it's mainly ignorance, prejudice, and then discrimination. Like Alberta said, the stigma is so much that people do not want to talk about mental health at all.
First of all, aggression. So when I realize someone is so aggressive, especially about little events, then I would want to presume the person is a little bit unstable, happy. As well, reading tells us that, or during the COVID era, we learned that a lot of withdrawal from social interaction can be one. We also learned sleeping too much. But for that one, I have a question. Since I'm a medical practitioner, because for some of us, we don't go out. Traditionally, our house is the land of go out. So we don't go out. So what we do is either we play a game, we watch movie, or we sleep. So if we are done playing the game and we are done watching the movie and we continue sleeping, is it depression?
Okay, so you see, when we talk about sleeping too much, okay, when it comes to depression, people who are depressed, their sleep is such that they don't want to even get out of bed. But from what you are describing, you've done everything you have to do in a day and then you've gone to sleep. That is normal. But if the person is sleeping so much that they don't even want to wake up and go and bath, they don't even want to eat, they don't even want to go to work or go to school, that is when it becomes a problem. So if it's not disrupting whatever you do in your life daily, the normal, then you don't have depression. And for people who sleep too much and then they are not able to perform normally, usually the symptoms have to go on for at least 2 weeks before you say the person is depressed. Yeah.
To add to what you said, it's not just excessive sleep. Some people want to sleep but they cannot sleep. Some people go to sleep for 1 hour and they are up. They want to go back to sleep again but they can't. All those things are also part of the symptoms. And also we didn't talk about hallucinations and suicidal thoughts. All these things are symptoms of mental illnesses. People will be seeing things, they could be hearing things that really don't exist. Okay, or they are the only ones who can see
them. Yeah.
So they are all symptoms of mental illness.
And then the thing to add to what Alberta said is that, funny enough, when we see people saying that I'm seeing something, I'm hearing something, then we start thinking, oh, you are seeing a ghost, you are seeing an evil spirit. Okay, sometimes it could just be that the person is having a hallucination, which comes with some mental health conditions. Okay. And the one thing I also want us to talk about is something they call presenteeism. Okay. So some people, even though they are there at the workplace, they are not productive. So instead of them being absent and you say absenteeism, they are present. However, they are not doing anything meaningful. So we say that the person has what the psychologists or psychiatrists will call presenteeism. Now, you realize that for mental illness, most people may not even present with some of these common signs and symptoms that we talked about. Okay, the person may have just a headache or sometimes stomach ache, and they'll go and see a doctor, a general practitioner. They'll do all lab tests and realize that, well, there's really nothing wrong with this person. But then the doctors will probably just tell the patient that, oh, you are okay, go home, without trying to see if they have a mental health, their mental health is okay or not. So, Alberta, you are in the health field. I want to find out, do you think that we, the people in the health, do you think we are doing well?
Well, I think that we should know that health is holistic. It's not just physical well-being.
Yeah.
You know the definition is physical, mental,
social. Yeah.
So you don't just assess a patient based on the physical symptoms they are presenting with. Some doctors go ahead and even do a mental state exam for every patient where they try to take into consideration how the patient's mood is, what is the affect of the patient and all that, the appearance. A patient walks into your clinic and the way the patient is dressed is not really appropriate for the weather. It's very cold and the patient is wearing a tank top, or it's very warm and the patient is in like 3 cardigans. All those things they are things that you should be questioning in your mind as a mental health person or even as a normal health practitioner. That's a doctor. Yes.
So like Alberta has rightly said, we doctors, I think we should try to do better. We are doing well, but I think we can do better. When the patient sits in front of you, it's not all about physical illness. If you assess and the patient is well physically, you should try to see if the patient is okay mentally as well. Sometimes just one question, how are you feeling today, or what emotions are you having, could actually let you know that your patient has a mental health problem and you can refer them to the appropriate headquarters. Now moving on, let's say that we've been able to diagnose a patient with a mental health condition, right? What are some of the treatment options that we can talk about? I would want to start with Gideon. Have you heard of any treatment options? Because sometimes there are very funny treatment options that people talk about. So I want to find out what you think the treatment options are for patients with mental health conditions.
Well, in Ghana, predominantly, first thing is prayers. So
interesting.
Church, depending on the church you attend, you get your dose of mental diagnosis and treatment. Well, because of why I know the Pantan health
psychiatric hospital.
Yes.
Okay.
But coming to that, I decided to check if there were other health services for mental issues.
Okay.
What I realized is yes, there are a number of them, but then again, most of them go down to churches, malams, some fetish priests. So I think in Ghana, the first call is spiritual because of the perceptions we have. Then when it gets beyond spiritual, you go to what I know is Pantan. Because ever since we were kids, if you want to say you're man, you say you have to send it to Pantan. So Pantan. I think Pantan is overhoused or it's having a lot of issues with facility. So we have a few private ones which happen to be the ones under the same pastors, malams, and fetish priests, which occasionally we have recently seen that some of these fetish priests do very, very unprintable things to these people that are sent there. So I think the treatment options in Ghana are limited, number one, and those available are not even enough. They're not well enough to help in Ghana. Well, I school in Kumasi, and I know people from Kumasi might take a pen at this, but in Kumasi, you realize you see a lot of mad people on the streets. And recently, I started working with them. You see a lot of mad people on the street. So I tell my friends in these areas that, you know why you go have a lot of mad people on the streets? You don't have a psychiatric hospital. So I think that's one of the best ways you can gauge it. The number of mad people you see on the street translates to our treatment option or treatment knowledge.
Okay. Ladies and gentlemen, we are still on the Mental Health Affairs show. I hope you are enjoying yourself and you are learning a lot just as I am. If this is your first time tuning in, I would want you to hit the subscribe button and turn on your notifications so that whenever we post a new video, you would be notified. And we would want to acknowledge our sponsor, would acknowledge House of Safori. It's an art gallery as well as a studio. They have services such as painting, they do sculpture, furniture, interior design, and then photography. You can locate House of Safori on the Focus Hospital Junction on the Adenta Ebri Road. You can contact them on 0248 821702, 0248 821702. Alberta, still on our treatment options, what are the treatment options that we have available?
Okay, so before I talk about the treatment, I realized that Gideon kept on saying mad. You shouldn't say that. Address them as people with a mental illness. It's not appropriate.
It's not nice to say that. That's true.
And then, so the treatment options, we talked about psychiatric hospitals, but you can also have pharmacotherapy and you can have psychotherapy, and there are some cognitive behavioral therapies as well. So with CBT, you have a psychologist talk to the patient. You are working together to try and find out the root cause of the issue. The patient would actually tell you their problems and then you solve it together. So that one doesn't take a lot of time. You just have like 8 meetings with a psychologist or psychiatrist. But with psychotherapy, it actually takes a very long time. So other treatment options would also be visiting the hospital. And for that one, the person would be admitted depending on how severe the person's presentation is. And if the person is not safe to be with people outside or in their homes, then the person is admitted over there.
Okay. So like she has rightly said, I think she has said it all. We have drugs that you can use for your conditions. We have cognitive behavioral therapy that she mentioned. And we also have electroconvulsive therapy for the very extreme cases. But then one thing I want our viewers to understand is that as you are watching, I want you to appreciate the fact that for mental health conditions, when you start taking the drugs, sometimes it has to take some time before the symptoms will start going away. And so if you take the drugs for a few days or a week or 2 and your symptoms are not gone, you shouldn't stop or give up. You have to continue because some of these drugs need some amount of time or concentration in your body before you can start feeling better, right?
About that. So on that point, there's perception widely known that mental health drugs are such that you take them forever because you don't normally see the results and then you keep taking them over and over and over and over. How true is this?
Okay, it's not that you keep taking them and then you don't see the results. I disagree with that part. But then the part where it says that you may have to take them forever, it's like that's because, you see, mental illnesses, God has given us an amount of knowledge about the brain, but then we don't have every understanding about how the brain functions. So sometimes these mental health conditions are such that you have chemical imbalances in your brain, and that's why you're taking these drugs to now, correct the imbalance that you already have. So if you stop taking the drug, you have what we call a relapse. Your symptoms may now come back. So it is important that you stay on the drugs so that the symptoms do not come back. Just like somebody who has hypertension or diabetes, the person may have to be taking antihypertensives or antidiabetics forever, okay? Just so that they can have a good blood pressure or a good blood sugar levels. So I don't think it's weird or absurd that you have to take these drugs forever. But then the part where it says that you take the drugs and you don't see any results, I totally disagree. You actually don't see the results when you don't take the drugs well as you're supposed to take them. But then if you do, you actually see improvements.
So as soon as you are diagnosed, the drug is for life.
So it's not every diagnosis that you actually even need drugs. Like she mentioned, sometimes you need just cognitive behavioral therapy. You just need to talk to the psychologist and then you find the roots of the issue, you solve that, and then you are fine. You may not have to take any drugs. But then if you do have to take drugs, sometimes you may even take the drugs, and then if the psychologist sees that you're at a point where there's complete resolution of your symptoms, they may even take you off the drugs for some time. Because some of these drugs will have side effects, so they may take you off the drugs for some time and monitor you to see how you are doing before they decide to put you back on them. Okay.
Thank you.
Yes, so ladies and gentlemen, to our final topic. I've heard so many funny myths and misconceptions about mental health. I mean, people believe so much, some weird and funny statements I've heard people make. Gideon, what are some of the funny myths and misconceptions that you've heard about mental health?
Well, the popular one, I believe, that it's in the family.
Okay.
You don't marry into this family. As soon as you was, so it's in the family. And then I think, secondly, it's a punishment. You've done something bad and now nature has found this way of punishing you.
Interesting.
And that is normally broadcast in movies too, because you watch movies and realize that someone does something bad and then the person goes mad. So that's the second. And I want to think those are the funniest ones I've heard so far. In the family, and when someone does something bad, the person gets.
Okay, so with what you said, I would agree partly and disagree. Because for the part where he said some people believe it runs in the family, it's actually true sometimes. Some mental health conditions actually run in some families. So if somebody has an auntie or a grandma or even a mom or a dad who has a particular mental health condition, it means that the person also has a risk of getting that mental health condition. So it could actually run in a family. But then the funny one is where they say the person is being punished. And like you rightly said, the media paints a very bad picture sometimes, and people, almost all of us, I can say like 80% are on the media. We see what happens. And so people believe what they see because of ignorance, they don't know. So what they see is what they believe. Yeah. So Alberta, what are some of the funny myths and misconceptions that you've also heard about mental health?
So one misconception I've heard is the fact that all people with mental illnesses would go naked at a point in time.
Interesting.
That is so not true. I don't know if I can correct as well.
Yeah,
so that's so not true because we've already come to see that somebody can have depression, somebody can have an addiction problem. All those things are mental illnesses, and the person will not necessarily go naked in the streets or something. So I think that's something to be corrected.
That's true. Now, one funny one that I have heard personally is that they said all psychologists themselves are also mentally ill. I don't know where people heard this from. They said all psychiatrists are also not mentally stable. Hey, people. The truth of the matter is that psychiatrists are very sane people. Now, they are also human beings. We may have some of them having mental illness at some point in their lives. They are not immortals. But then it is not true that every psychiatrist has a mental health problem. And some people even go to the extent of saying that once you enter Accra Psychiatric Hospital and you come out, you will not be mentally stable. I've heard it before. So I remember during our rotation for psychiatry, when we were going to Accra Psychiatric Hospital, I was like, okay, let me go and come out and see if I'll still be mentally okay. I went in and I came back. As I'm sitting here, maybe you people can tell me whether I'm going mad and I don't know. Yes, I'm fine, right? Yes, so these are some of the funny things that we hear about mental health, and they are not true. And so like we said, if you learn more, you read more about mental health, when somebody is saying something that is not true, you would be able to tell that this person is lying to you. Yes. Also, soon we've come to the end of our discussion, but before we close this particular chapter, I want to see if there are any final words from my amazing guests. So I'll start with you, Alberta. What are your final words for my audience?
Okay, so I just want us all to know that mental illness is not a damnation in itself. There's a cure, there are treatments for it. So you don't see someone with a mental illness and think that the person is damned for life. With such a thought, you will actually be adding to the problem and not solving the problem. And also, once you've heard something about mental health, know that you are now responsible for that knowledge that you have. So what you do with that knowledge is really important, and you have to tell others about mental health. We are all supposed to be creating awareness about mental health. So that's something that we should all take note of. Okay, so Gideon, what are your final words too?
From our interactions today, I've come to realize that mental health is just as the way you are walking and you injure your leg. Each one of us is exposed to mental health disorder or mental health varieties. And when you are exposed, you should not find it so weird or be fearful of the stigma. You should be able to come out, see a doctor, see a colleague, see a counselor, find help. Because the only way you can be productive in life and in society is when you have a good state of mind. And I believe that's all what we want as youth or as people living. We want to be very productive in our lives. So we should accept that we are prone to mental health, and the least of it, being stress, anxiety, depression, needs some form of external attention. Yes, maybe you can come to a resolution yourself, but asking for help is nothing wrong. We should learn how to ask for help. We can talk to our friends, and like Alberta rightly said, now that we know about mental health and we know at least one sign or symptom or two, we should be able to help our colleagues, not by shaming them by saying they have a mental health disorder, but we should be able to go to them and say, what is the problem? How can we help? Or refer them to a counselor. Back in school at KUniversity, we had peer counselors. So in every class, on every floor, in every hostel, there was a peer counselor. So it's easy for those in KUniversity to do this. But for those of us who are living in our normal lives with our normal colleagues, we should find people we can always refer people to for some sort of mental health diagnosis or
help. Yes. So with that, I would want my audience to know that one doctor in Kolebu and his team, they are called the Mind IT team. They've come up with a short code that if you have any signs and symptoms of mental illness, you can just dial this short code on your phone, and then if they think that you need to see a professional, they would refer you to a psychologist or a clinical psychiatrist in your society or near you so that you can get the help that you need. So the short code is *844 *555 hash. *844 *555 hash. So if at any point in time you think you need help or you have a relative or a friend that needs help, please don't hesitate to dial the short code and get them the help that they need. So viewers, before we leave, I want us to take our quotes for the day. Our quote for the day is coming from Glenn Close. She is also a mental health advocate, and she says that what mental health needs is more sunlight, more candor, and then more unashamed conversation. I am Iya the Medic, and I'll see you next time. Bye.